Hello and welcome to another episode of The Holistic Way. My name is Todd Hart. I'm the host of the show. And today's guest we actually met at a party.
Yes, we did.
We spent about a half hour talking about what you do, and at the end of it I said, boy, this would be really good for you to come on my show and talk about it. So Antonia, welcome to the show.
Thank you so much, Todd, for hosting me. I really appreciate it.
You're very welcome. Why don't you introduce yourself and tell us what you do?
Certainly. So first and foremost, I am a licensed massage therapist, but I currently go by the title of NeuroKinetic Therapist because that's where my position has transformed into. I'm also a certified personal trainer.
Now, tell me about NeuroKinetic Therapy, because I found that very fascinating when we were talking about it. Give us kind of a background of that, a history of like, what is it? What does it mean?
Sure. So part of the reason why I got into NeuroKinetic Therapy was because it was so fascinating. I was just about to graduate from school for massage therapy, and a classmate of mine whose girlfriend had been having some pretty serious issues told me about it, and it had helped her. So I started researching online, looking at the YouTube, looking at the Facebook, and I was like, wow, this stuff is really cool. I liked it because it seemed like it got to the core of the issues, and I'm a very, very curious person by nature. You know, in school, you would find things that were tight on people and you'd release them, and I always would wonder, well, why are they tight? Why does that person have pain there? So NeuroKinetic Therapy is a very unique and effective approach to understanding pain and dysfunction in the body. A trained neurokinetic therapist uses highly specific manual muscle testing to locate, assess, and treat compensation patterns within the body. So for example, every time that a person wants to move, their brain has to send signals to all of the muscles that are necessary to complete that movement. Now, sometimes, for whatever reason, be it injury or postural stress, certain muscles can become what we call functionally inhibited. This means that they aren't receiving the signal from the brain properly, the way that they should. In this circumstance, what the brain does, because it's amazing and because you want to get things done, the brain says, all right, that muscle's not available right now, we're going to use something else to get this movement done for you. So that's how a compensation pattern is formed. So you'll get the movement done, but it won't be in the most efficient manner. And this can then lead to several other compensation patterns: stress, injury, and pain.
So I would think that almost creates a domino effect in the body.
Certainly
where
does.
That's causing something to do something else, and then it just sort of dominoes out of control from there.
Absolutely.
Wow. No, so what's the history? Who started this? Where did it, how long has it been around?
NeuroKinetic Therapy is a fairly new technique. It was developed by a man named David Weinstock out in California. It's been around, I believe, since about 2010, been being taught. It's been growing very rapidly, and now we have practitioners all over the world.
And how many people are out there doing it right now?
I'm not sure of the exact number. I know it depends on what level as well. There are 3 levels, level 1, 2, and 3 of NeuroKinetic Therapy that practitioners can choose to progress into in their practice. And also there are all different kinds of practitioners who are able to learn neurokinetic therapy. Anyone from a medical doctor to a physical therapist to a chiropractor to a Pilates instructor or a massage therapist like myself.
So it's just an additional an adjunct to what you're doing already.
Exactly.
So, and what I'm thinking about as you're talking about this is I'm thinking about traditional medicine, how it'll kind of you take a pill and it just sort of covers up what's ever going on. It'll mask it. It'll send a different signal to the brain. You don't feel the pain, but no one's really going to the root cause and fixing that. So that it sounds like you're doing that.
That's what it's all about. That's what it's all about. Neurokinetic therapy is fun because the body tells you the story. And it sort of takes some of the pressure off of you as a practitioner, where you don't have to make things up. You can watch a person move and see what you think is going on with their body, listen to their story, and then you confirm it with the manual muscle testing, and the body will tell you, yes, this is what's happening, or no, it's not. Keep looking.
What is manual muscle testing? What does that mean when you say that?
So to establish whether a muscle is getting a good amount of neural feed from the brain, a practitioner will bring that muscle through its range of motion and apply pressure to it. For example, do you want me to show you on your arm?
If we can do it without getting up.
Can we do it? Yeah. So for your bicep, you would start in this position.
Okay.
And then I would have you take a breath in, exhale, and resist me here. Good, perfect. So you'll notice I only use a light pressure. Traditional manual muscle testing uses a lot of pressure, and they're more testing for strength.
Okay.
We're not testing for strength, or we do as we progress, but at first we're just testing for neural availability, trying to see how strong of a message that muscle is getting from the brain. And now say I were to just do that to you, and it was to test inhibited, then we know that something's compensating for that muscle or movement, and we need to find out what that is.
So this is all you doing this? There's no machines involved? There's no connections?
Nope.
Okay. And you're sensitive enough to know if there's something off?
Yes, and it's not just me, the client will feel it as well. They'll feel, oh yeah, I can meet your pressure, no problem, or there's no way I'm meeting your pressure, it's just not even there.
Well, I recall being at my physical therapist, because I have some neck stuff that I'm dealing with,
Oh, really?
and I remember laying flat on the table and putting my arm out like this, and her saying, okay, now raise it, and I'm going to push it down, and I had nothing. I'm just, it's like, yeah, okay, I can't resist you. And I had no muscles back here, so she has me doing things so that my shoulders roll back, which I'm assuming is similar to what you're talking about.
Slightly similar, yes. The NeuroKinetic Therapy style of manual muscle testing is very unique, but similar in concept to that. You're looking for whether there is function or dysfunction.
So after you and I meeting, I mentioned you to her, and I was talking about my neck, and she was saying that we were talking about the muscles here. So she now has me doing an exercise where I'm laying on the floor, and I'm bringing my neck like this, and I'm just raising it just like a hair off the floor,
Yes.
which is strengthening. And since I've been doing that, I notice I don't have as much neck pain.
Excellent.
Because I think this is now keeping my head down. So thank you for that.
You're welcome.
That led the conversation to take place.
Yeah, sometimes you get lucky in that sort of more of a traditional sense of just sort of guessing what might be weak and then strengthening it. The NeuroKinetic Therapy protocol, the reason why it's different is first we use the manual muscle testing to establish a definitive pattern where it's not just a guess, it's okay, we're confirming this. And then the protocol to correct that pattern is to first release what's overworking, or facilitated is the word that we use, and then immediately follow that by then activating whatever has been inhibited. So for you, it would be your deep neck flexors.
Right.
The reason why this is most effective is because when you release a muscle, the muscle that's been overworking and compensating, that muscle, there's a period of time where it can't receive a strong signal from the brain at that point. So you take advantage of that window to then send the signal to the area that hasn't been receiving it in a functional way. And that way the brain will be more apt to then choose that pathway.
Create a new pathway. So how do you release the muscle?
So there are various different techniques that a practitioner could use depending on their scope of practice. So for a personal trainer or a yoga instructor or Pilates instructor, there's different legalities or different rules of how they would be able to perform releases than a chiropractor or a physical therapist or a massage therapist. For me, myself, because I'm a massage therapist, I can use manual therapy. The technique that I most frequently use would be myofascial release.
Okay.
And that is a form of manual release that focuses on the fascia, the connective tissue of the body. I find it to be the most effective.
Now, is that like a pressure point thing, or is that more manual massage?
Very different than pressure point technique. So trigger point technique is where you apply deep pressure to a trigger point in the muscle, which is just a area in spasm, until it releases. Myofascial release is more of a sustained tractioning of the tissue, anywhere from 2 to 4 minutes, which allows a slow and more permanent change to happen. And it happens on a deeper level.
Okay. So is it just one time that you would do that to release it? And then you're saying that the brain then is not communicating with that area as effectively?
For a short window of time, yes.
Okay. Like minutes, hours?
Probably about 30 seconds.
Oh, okay. So you have to quickly then get them to do something else.
Exactly.
Now, do they then do that on their own?
Yes, they do.
They'll release, they'll build?
That is the key.
Okay.
That is the key. That's the difference between neurokinetic therapy and a lot of other kinds of therapy where we're telling our clients, listen, this is partially on you. You need to make the choice to make positive changes in your daily life to reestablish more functional movement.
Okay.
That's the only way that the brain learns is through repetition. So we can change the short-term memory in our session, but in order to change the long-term memory, the client has to incorporate that into their everyday life. And that's something that is a part of my sessions, guiding my clients through how to do that.
Now, traditionally, how many sessions does someone have with you when they have an injury or they're dealing with an issue?
So that can vary greatly depending on the person's health history, depending on what their priorities and goals are. It's pretty impossible for me to give an average number of sessions that would be needed. Normally, I would say we can definitely make big changes in the first session where the person can feel and see a difference. Absolutely.
And when you give them not homework, but exercises to do at home, what's the amount of time that they're spending doing that?
I try to keep it no more than 5 minutes.
Oh, really?
Absolutely.
Once a day?
Preferably twice.
Okay.
But if a person can only do it once is better than nothing, right?
That seems pretty easy.
I try to keep it as easy as possible.
Easy to do, easy not to do too as well, I guess, right? We all get busy. And
Well, I'm understanding of that, definitely. Sometimes clients will come in and they'll say, oh, I had a rough week, I wasn't able to do it. And say, I'm not going to yell at you.
Right.
I get it, I understand.
Yeah.
Let's just keep going.
Yeah.
Yeah.
So who traditionally would come to you? What are they dealing with? What are they experiencing that they would think of you and come to you?
So my ideal clientele, I would say, what I'm trying to really establish more of a clientele in would be child athletes, because I feel like I can make the most difference there. Kids, when they're playing sports, they're usually playing several times a week, and their bodies are growing, changing, and they're only starting to understand what movement feels like for them. So helping them to learn how to move better and how to move more safely is a big priority for me in preventing future injuries, and also in helping them be better at their sport. I love working with anyone who has any kind of movement practice because they can see the difference. So, okay, I could only squat 100 pounds, now I can squat 150. I could only run a mile in 8 minutes, now I can run it in 7, etc. So I love working with people who have a movement practice, but I also love working with anyone who is in any kind of chronic pain, especially people who have kind of lost hope, that they haven't been able to find any luck with any other practitioners or any other modalities.
Right.
Conditions that I treat, so I guess running from head to toe, head trauma or concussions, these can have a huge impact on motor control and always need to be corrected and assessed in order to make sure that a person is functioning properly. TMJ and jaw problems, that's huge, very common. Whiplash from car accidents or neck pain from a desk job. Shoulder, rotator cuff injuries or issues, carpal tunnel, tennis elbow.
The mouse all day on the computer, that kind of stuff.
Tennis elbow, lower back pain, huge, giant. That's so common and so treatable.
What is the typical cause of lower back pain in people?
I would say the first place that I go is core inhibition. Usually that person will have some sort of compensation pattern where they aren't able to access their core musculature properly. And this is also an issue for people who, they work out so hard, but for whatever reason, they can't ever, I'm always bad at any sort of core work. No matter how much I do it, I never feel it in my core. I feel it in my neck. I wonder why.
Yeah.
What's your neck doing that your core isn't?
Right.
Simple.
It's like guys that never work out their legs and they're big up top and their skinny legs, right? You see it all the time.
Their legs are probably inhibited and they probably don't like to work them out. Usually the movements that people don't like to do, there's some sort of dysfunction.
There's something wrong going on there.
Movement shouldn't be difficult. Movement should feel awesome. Everyone should love to move. Usually the reason why people don't like to move is because they know inherently something's wrong here. They just don't know what. And I love to help them find that out and correct it.
Going back to concussions, what are some of the things that you might look for in a person that they might want to come to you? Because I've known several people that have had concussions in the past 6 months, so that's why I asked that question.
Absolutely. So the way that we assess concussions, this is a level 3 NeuroKinetic Therapy material. We would use manual muscle testing in conjunction with having them move their eyes in certain directions, or we would just watch the way that their eyes track. And that's usually a good indicator if there's some sort of dysfunction in those assessments, that there was dysfunction caused by the concussion. Obviously, your eyes are extremely important to the way you move because we dictate where we are in space in large by what we see.
Right.
And then we move by where our brain thinks that we are in space. Proprioception is the term for that. So if you have issues with vision, you're going to have issues with movement as well.
Right. What about someone that has curvature of the spine, scoliosis?
Yes, that is treatable, absolutely.
So what do you do with something like that? How do you handle that?
So we would just assess the muscles around the spine. and assess their movement. History is a big deal. When I have clients come in to have a session with me, the first thing that we do, I have them fill out an intake form, and then we start asking questions. You know, do you have any scars anywhere? Have you had any head trauma? How many car accidents have you been in? Did you have any trauma as a child? Everything is important because that's your story. And every little bit of trauma that has happened to your body is stored in your brain and could very well be and may be affecting your motor control, the way that you move.
So how do you handle scoliosis? Are you strengthening the back muscles? Are you strengthening the core to kind of support that out of whack spine to prevent it from creating a domino effect?
So it changes from person to person. There can be several different causes of scoliosis, and it all depends on what I find with my assessment. One of the things that I love most about NKT, NeuroKinetic Therapy, is that every session is extremely individual. No two sessions are alike, and the way that I treat one person who has scoliosis may be completely different from the way that I treat another person. It all depends on like I said, what it was that caused that scoliosis to begin with and what's happening in their body now.
Right. And what if they have it but they're not bothered by it?
That's very common. It's funny that you mentioned that. My NeuroKinetic Therapy level 1 and 2 instructor, a woman named Dr. Kathy Dooley, I would recommend that you check out her blog. It's called Dr. Dooley Noted. She's incredible. So she is a chiropractor among several other things, and she posted a case study about a client who had severe scoliosis. She posted the radiograph, and it was, you know, very dramatic. This person had no pain, and it's also very common for people to have bulging discs and the like, and not have pain either. Pain is a very interesting thing. The way that people perceive pain, that changes from one person to another. So my concern in that situation where someone has scoliosis but doesn't have pain, well, are they having any other kinds of issues from it? Is it preventing the way that they move? Could it potentially be dangerous in any sort of situation? And then I would incorporate movement practice, so that's where being a personal trainer comes in. I would say, okay, we're gonna really wanna strengthen your ability to squat and to deadlift properly so that you can carry over these movements into your daily life in a safe way so that you make sure that you don't end up getting injured.
Right. Now, do you have a gym where you are, where you can show
them things? I don't have a gym. My office is out of Winchester, Mass, and it's just a small office in an acupuncture studio. But I'm able to use a space in Winthrop, Massachusetts, which is a yoga studio called the Yoga Lounge for workshops and for personal training.
Yep. Very familiar with that place.
Yeah.
How do people get a hold of you? What is your website? We might as well mention that now.
My website is www.functionalbodywork.net. My Facebook is facebook.com/functionalbodywork. And my email address is antonialongo.lmt@gmail.com.
Awesome. And the email for the show is theholisticway@hotmail.com. There it is on the screen, theholisticway@hotmail.com. So if you have any questions for myself, Antonia, you can always send me an email as well if you missed anything, and I'll gladly connect you with her. What other modalities do you do besides this? You mentioned massage. What else do you do?
Yes, so I started out as a massage therapist, and upon graduation, I loved school, but I realized that there was still a lot for me to learn. So that was when I started my path into continuing education, which is something that I'll be continuing for the rest of my life. I started out with NeuroKinetic Therapy, took levels 1 and 2 consecutively. Now I've taken all 3 levels and certified in level 3. Which makes me an NKT master.
Nice.
There's only, I believe, less than 60 of us in the whole world.
Really?
Yeah. Yep.
Whoa,
so
congratulations.
that's pretty awesome. Yeah. It's, oh man, since I've taken level 3, everything has just gone to the next level, so to speak. It's amazing. For all my other NKT people out there who are watching this, keep going. It gets better.
That's awesome.
So other than NKT, I've also taken some courses in myofascial release, which is a manual therapy, like we spoke about earlier. I became ISSA certified personal trainer. Okay. And I've taken other classes that have helped me to understand movement, such as FMS, which is Functional Movement Screen, level 1, SFMA, Selective Functional Movement Assessment, level 1, Original Strength Foundations. And I've also taken, one of the classes that I really enjoyed was functional range conditioning, which is it's kind of like yoga except different because it focuses on conditioning the joints so that you are able to obtain mobility with control. And that's what really distinguishes it, because if you can just, throw your leg behind your back, but you aren't able to control that movement, it actually puts you at a greater risk for injury, especially injury to the ligaments, which is bad. You don't want that.
Right.
So functional range conditioning is its own little sort of modality in that manner. I've also taken immaculate dissection most recently, which was amazing. That's my NeuroKinetic Therapy instructor. It's her own seminar series that she just formulated and started teaching. And it combines anatomy, because she's also a college anatomy professor. So it combines teaching anatomy, advanced anatomy, and corrective exercise, puts them together. Because for those of us who are really into the sort of physio world, we have an understanding that you really can't treat pain without incorporating movement into the rehabilitative process as well.
I actually had a motorcycle accident years and years ago, maybe 30? No, maybe, 20, 26, 25, 20, something like that. I remember going to a doctor, and the one thing he said to me is, the best advice I'll ever give you is just get out and walk. He said, it's the best thing for your back, best thing for your body. You gotta move. He said, if you're not willing to do that, he goes, there's nothing I can do for you. And I'll never forget that.
That's how the joints produce synovial fluid, is movement. So you need that, otherwise your joints are going to be pretty cranky.
Well, it's funny, because if you tell someone that has a backache, well, have you walked? Like, well, I can't walk, it hurts. I'm like, well, so what do? I just lay down. I'm like, that's not good.
Not good. You gotta find a middle ground. Yes, find a qualified practitioner to help you with the pain.
Sure.
But do what you can in the meantime. Even if it's just, say a person had surgery on their shoulder, and they can't move their shoulder because they just had surgery. Well, what you can do is you can move your hand like this. You can move your neck like this. This helps get the lymph flowing. And that's huge in regards to healing. Speaking of lymphatic drainage was another course that I took to help if I have clients who do end up needing surgery for whatever reason, which we try to prevent that, but if they do, then I can help them in the recovery process as well.
And you also partner with doctors, correct?
I like to. I like to be in good communication with doctors. I think that it's really important for a team of professionals to all be in communication with each other and understanding in regards to a patient. There are certain ailments that I can't treat, certain issues that are out of my scope of practice. So I have a pretty big network of professionals that I refer out to for issues that are not something that I can help, but I want to make sure that I send my client to someone who I trust and to someone who is very good. And then we stay in communication with each other to make sure that everything is flowing smoothly, that we're both on the same page.
Nice.
And we're like your little team, your own personal team.
So what's your next goal as far as professional goals and education-wise?
So I'd have to say that continuing to learn, just always keep learning. It's really important to me to never stagnate or to never become dogmatic about what I do. I'm very much open to, if I find that something that I'm doing right now isn't the best way of doing it, I'll drop it and I'll move forward. Because at the end of the day, the reason why I took this path was because I wanted to provide the most effective, comprehensive, dynamic treatments for my clients as possible, because that's what I would want. And that's what I believe in. I'm a very all or nothing person, and if I'm going to do something, I'm going to do it to the best of my ability.
So again, you've got about a minute left. As far as people that are out there, again, what are they dealing with that they should come to you? Headaches? I mean, they're having backaches, trouble sleeping? Or what are some of the things that people are dealing with?
Absolutely. Tension, headaches, trouble sleeping. Where do we leave off? We left off at carpal tunnel, I think. Lower back pain.
Yep, lower back pain.
Hip pain, recovering from surgery, trying to avoid surgery. Pelvic floor dysfunction. That's a huge one that no one knows how to treat. It's actually really simple.
Never heard of it.
Yeah.
Don't even know what that is.
Knee problems, ankle sprains, long-standing history of ankle sprains, need to get that treated. Bunions, plantar fasciitis, chronically tight hamstrings, weak glutes, weak core, inability to perform a certain exercise. All of it. I love it.
Nice.
It's one big puzzle, and it is so much fun.
I can tell that you love it, and that's why I wanted you to come on the show, because you have a passion for it. You light up when you talk about it. You got me excited about it. So thank you for coming on the show.
Thank you so much for having me,
The
Todd.
time went
This was
very
great.
quickly.
Yeah, it did.
So again, if you have any questions, feel free to reach out to me at The Holistic Way, theholisticway@hotmail.com. I'm Todd Hart. Thank you for watching the show. Stay healthy.